Inadequate vitamin B12 absorption is the most common cause of deficiency of B12. Different scenarios are there. If we take the elderly, we require acid for breaking the vitamin B12 from the R binder in, in the stomach so that it can be bound to the other factors, that is the intrinsic factor. So therefore, if in the acidity is not proper, then also vitamin B12 may not be absorbed for that reason. So in elderly, this is the reason, because they lose their capacity to produce acid considerably. Second thing is that if there is overgrowth of bacteria in the gut, this occurs in states where there is stasis in the gut or there is a blind loop. For example, which was done previously in the Roux-en-Y operation. So in the Roux-en-Y operation, when it was done, a lot of bacteria used to grow into the loop. So it is called the blind loop syndrome. Now these bacteria, they consume the vitamin B12 and decrease its level. Similar mechanism exists in the case of fish tapeworm, which is also called diphylbothrum datum. This tapeworm also consumes the vitamin B12. So then comes the problem at the level of ileum. At the level of ileum, where the absorption of the intrinsic factor and the vitamin B12 was to take place, where the intrinsic factor was separated and the vitamin was combined with cobalamin, and later in the blood it was combined with transaminases, not transaminases, transferrin. So, not transferrin, transcobalamin. Here also the problem can occur, that the ileal surface is not available for absorption. This can occur in diffuse diseases of the ileum, like in cases of tuberculosis of the ileum, Crohn's disease. So there can be a problem here also. Then if there is chronic pancreatitis, that also can lead to vitamin B12 deficiency. Then use of certain drugs like antacids, it can reduce the acidity, and metformin also can reduce the absorption of vitamin B12. Repeated exposure to nitrous oxide. Now, nitrous oxide converts vitamin B12 into an inactive form. So therefore, it also leads to a kind of defect of the vitamin B12. Then there can be defects of certain genes like the CUBN gene, which translates for a protein called tubulin, and amnion-less AMN gene. Now these result in decreased absorption of vitamin B12, and along with that there may be sometimes proteinuria. So this disease is called Ehlers-Danlos-Greisbach syndrome. So these are the various causes of decreased absorption of the vitamin B12. If I try to gist it, it can be due to decreased acid production in the case of elderly, and antacids for the same mechanism if they are taken chronically. Then there can be blind loop syndrome, there can be fish tapeworm, then there can be problem with the ileal absorptive sites in the form of tuberculosis, Crohn's disease, and then certain drugs like metformin, they can cause the problem. Then chronic pancreatitis, and drugs like nitrous oxide, if they are used, they also can lead to, and sometimes genetic causes involving tubulin protein and CUBN gene or amnion-less and AMN gene. These can lead to a syndrome which is called Ehlers-Danlos-Greisbach syndrome.